If you are currently dealing with any kind of health challenge right now, any kind of health issue, maybe you're just not feeling great, you don't have energy, or you have digestive issues or autoimmune problems, or you're dealing with something like cancer or heart disease, any kind of health issue at all, check out Extreme Health Academy. This is going to be the #1 place where people are going to be able to come together and get answers and get the tools and the resources they need in order to overcome their health issues. So this is going to be the place where everyone's going to come, and it's going to be huge. We're currently partnering with Dr. John Bergman, who is a fan favorite, and we're going to be putting together courses so that you can overcome these things naturally. And so we're going to be adding courses every single month. There's going to be webinars, live Q&A, access to the doctor where you can ask your questions, all kinds of really cool stuff, a forum and a community in there. We're going to be able to help each other. It's going to be amazing. So make sure to check out the Extreme Health Academy. And we're also brought to you by our store. If you haven't checked out our store lately, thank you for checking it out. We've got all kinds of cool stuff. We've got the Organifi green juice powder. Some of the more recent products we have on there are the Rapid Release Technology Pro, which I used on my back, and it made a huge turnaround in my back pain. And there's also the Andreas Sacred Seed Oils. We've got EMF Defender pads for your laptop. We've got grounded bed sheets, magnetic sleep pads. We've got the Soul CBD oils. We've got the Aura Wellness Shine to help remineralize your teeth. We've got the Lung Cleanse from Allertrex. We've got the #1 vitamin mineral supplement in the world, Intramax and Intramin. We've got Accelerated Silver, which I use to nebulize almost every single day. We've got oxygen concentrators, PEMF machines, Chi Vitalizer machines, sauna domes. We've got the PEMF IMRS pad, detox powder, all kinds of cool stuff in our store. So make sure to check out our store out if you haven't shopped there recently, and check out some of the products there and see how they can help you. All right, thanks so much, everybody, for tuning in to another episode here of Extreme Health Radio. Appreciate your listenership and appreciate you joining us for another show. Today, we're going to be talking about the heart. The heart. And it is the second leading cause of death. You know, I was just reading a statistic the other day. It said something like there's 1 million heart attacks. 1 million heart attacks will occur just this year, and that will result in roughly 500,000 deaths. And coronary artery disease is currently the leading cause of death in the United States, which is just crazy. So we've got Dr. Thomas Cowan on the show. He has written some good books about this subject. He's written The Fourfold Path to Healing, The Nourishing Traditions Book of Baby and Childcare. He co-authored that with Sally Fallon. This new one, though, is going to be really, really cool. We're going to be talking about his new book called The Human Heart, Cosmic Heart, A Doctor's Quest to Understand, Treat, and Prevent Cardiovascular Disease. And this is near and dear to my heart because when I was 15, I was diagnosed with hypertrophic cardiomyopathy when I was playing basketball. So his book deals with a new understanding of the role of the heart in the human body, and he talks a lot about the heart not being a pump. And it also deals with the connection between the heart and gold, the heart and love, and the true cause of heart disease and how to prevent and treat it. So this is going to be a really, really great show. Thomas Cowan, let me give you just a little quick little bio. Graduated from Michigan State University College of Human Medicine in 1984. And after his residency in family practice at Johnson City Hospital in Johnson City, New York, he set up an anthroposophical medicine practice in Petersburg, New Hampshire. And then he relocated to San Francisco back in 2003. So let me just turn down the music. Dr. Cowan, can you hear us all right?
Yeah, I was trouble hearing you with the music on, but now I can hear you.
We have to get that fixed. There's some cause for that. We're not sure what it is, but I'm glad you can hear us now. Excellent. Thanks for joining us today.
Thank you for having me on your show.
Yeah, no worries. I'm glad because we originally talked to you back on episode 457. And we talked in that show about the heart not being a pump, and we went into a lot of really, really cool things that you talked about. And now your new book, Human Heart, Cosmic Heart, that just recently got released. Is that right?
October of 2016. 2015, yeah.
Okay. I was saying, I'm not sure if you heard in the intro, but I was reading some of the bullet points about that, which was, the first one is interesting to me, a new understanding of the role of the heart in the human body.
I mean, well, it gets into the whole question of why does the blood move in the body? Or in other words, why is there circulation?
Mm-hmm.
And if you go back into the history of it, and there's actually something that I must say I got maybe a little bit not correct for some interesting reasons, but it used to be that the blood was thought to be moved by some vital force. And we're talking historically, ancient Greece and Chinese theory, etc. So that was for thousands of years. And then I put the time, or the person who changed that, to be a guy named William Harvey, who's considered the father of cardiology. And he was the first one, allegedly, to say, no, the heart, the circulation is a circuit, arteries, capillaries, veins to the heart, arteries, capillaries, veins to the heart. And that the function of the heart is to propel the blood along that pathway. That's the common understanding. It turns out since then I've actually read a book on William Harvey, and he was adamantly opposed to the idea that the heart pushed the blood around the body. It was actually a guy named, who I'm sure most people have heard of, called René Descartes, who is a famous French philosopher. He was the first to promote the idea that the heart pushes the blood around the body. And his thing was that the human being is a mechanical device, and that there's nothing else that's relevant, and everything that happens in the human being should be explainable by simple laws of mechanics. That's an interesting and I would say actually crazy thing to say, but Descartes was fairly famous, and he won the day. Actually, he and Harvey were at odds with each other about this. Really?
Yeah, it's interesting that even today, that's the model that's sort of talked about. Like in the current medical paradigm, the model is that we are, mechanical beings, and you can just take and replace parts at will, and it's almost like they treat us, like we're like a car engine or something,
Exactly. And, the interesting thing about all these things is we talk about that as if it was fact, as if somehow like God or somebody named science came down and told us that's the way it was. Right. But the fact of the matter, it wasn't God or science, it was Descartes. And he was he was smart, but he was kind of crazy and very sort of strange fellow. So it's just because of him and then his followers. It's not like it was proven or anything.
So he had a following of people that were very, very closely loyal to him that pushed his philosophies even after he died, right?
Absolutely.
Yeah.
And then it became that if you didn't agree with that, you were somehow considered, somewhere between a silly human being and a lunatic.
Right.
And that's what we have today. So if you go into as I have, into a grand rounds or a group of doctors, it may be a little different. The example I'm going to give is 20 years ago. And you say something like, well, we associate the heart with love, and nobody can actually find love in the heart if you dissect the heart. So if you tell your wife you love them with all your heart, and the rules of the game are you have to have a physical, mechanical object in order to believe it's real. It's actually happened to me that the doctors in the room started going like, ooh, like that, like being derisive to even a simple and well-accepted idea. Right. Like that. Like there is other reality besides just mechanical, physical stuff. It's obvious, because there is no love in the heart, and yet we all believe that somehow, even football coaches tell people to play with all their heart. And what could that possibly mean? There is no play or effort in the heart.
Right.
So we all believe, as human beings in other, aspects of life than just mechanics.
Now,
we just do.
Is the reason why the doctors, even back then and today, don't accept that is because it sounds good, like it's a nice little thing to say, but because, like you said, it's not quantifiable, you can't measure it. And is it just because of all of that and you can't have science based around all these other things? Is that kind of the idea?
I mean, it's an interesting question because if you look at the definition of science, at least according to Wikipedia, it's the belief that the only physical, quantifiable things exist in nature, which is frankly absurd, right? I mean, that means there's no emotions, there's no thinking, there's no love, there's no humor, there's no... One of the examples I point out is if you play a musical score, there's notes and there's rhythm. Those things exist on the score, but musicality, which is what we all go to listen to music for, that's not written anywhere. You can't write, play it with passion or slowly with meaning. That doesn't... So that's the definition of science, which I would say people today have been over-schooled to believe in it, in contrast to what everything in their human nature literally screams out for them to not believe this. I mean, every instinct, every experience you have, but we're the people who are taught to not trust your experience, not trust your direct observation, because somehow you're all that can be misled. That you have to believe in so-called double-blind studies, even though by definition that takes the consciousness out of it, which arguably is the most important thing about being a human being.
And I was just listening to something recently that the scientist doctor guy was saying there are no such things as real double-blind studies, like they don't exist.
Of course not. It's nonsense. Now, I'm not against, carefully analyzing information. Don't get me wrong. If you get 10 people who do better with this and then this, that's relevant information. But there is no, quantum physics says that, a particle is a wave or a particle depending on whether somebody is observing it or not. In other words, at the very core of reality, consciousness has this sort of unexplained role. And, in a way, everybody gets that except, frankly, the doctors.
Well, it makes sense given their medical system and given their the way they make money, because you can make money on things that can be replaced or levels that you can artificially manipulate with numbers and giving drugs. And I mean, it makes total sense that would be the model that would win out, but in doing so, like you're saying, is they're leaving out a huge factor as to what's really going on.
Well, they're leaving out the reason we're all alive and all the things we care about. And don't be mistaken about this. This idea that this is the way we're going to do medicine was a very conscious decision by a small number of people and codified in something called the Flexner report back in the 1920s. This was a deliberate scheme to, basically to create a pharmaceutical industry. And now we have a situation where, in a sense, the definition of a modern doctor is that human being who believes that the only way people can heal is through surgery or patent pharmaceutical medicines. That's it. Human beings literally cannot heal in any other way. Any other way, they say that's just not scientific or whatever they say.
Mm-hmm.
And that's a crazy idea.
Yeah, I know. And we've talked a lot about the Flexner report and all of the bizarre circumstances going in to that. And then, you know, what's really crazy to me is around that time, such an interesting time of medicine in the early 1900s where, you know, they were railroading Harry Hoxsey, Dr. Hoxsey. They were doing the same thing with Royal Rife. And there's so many different people doing interesting work that they were just, you know, Lawrence Fishbein, I think he was the head of the AMA, and he was going after both of these guys. And it's just so many fishy, weird things going on back then.
Yeah, right.
Yeah, it's so bizarre. And so we're not mechanical. We're mechanical in a sense that we do have hearts, we do have lungs, but maybe the thing that runs these things is inherently non-corporeal, non-mechanical, invisible processes, right?
Well, the word for it is we are quantum coherent organisms.
Okay.
That run on, you know, basically multiple levels of functionality, including things that we don't know how to measure and things that we do know how to measure.
Uh-huh.
And in a sense, these different layers of reality and existence all interface and interact with each other to create, you know, this amazing thing, or whatever you want to word you use, called a human being. Mm-hmm. And again, we've decided to basically discard, you know, most of that, including the important parts, and just focus on the mechanics, which does have effects. Nobody is saying, you know, taking your pancreas out or whatever doesn't have an effect, or may not even it may even have a good effect if you put a new pancreas in. But that's not healing. That's basically plumbing.
Mm-hmm. Right. Now tell me if I'm wrong in this. I was listening to a doctor, this is going back a year or more ago, so I don't remember completely, but he was talking about some tests or some studies they've done with mice, or I'm not sure if mice were the animal, but you probably know about this, where they literally shut down all of the major valves to the heart, and the mouse never had a heart attack. I mean, it's absolutely crazy what they've done. The study was showing that, you know, it's not the blockage of the valves, there's something else going on here.
So I'm not sure if you're mistaking valves for arteries.
Oh, okay, right.
Yeah, so there have been a number of studies that show, for instance, with dog studies and maybe with mice or rats, I'm not sure about that, but they've been doing this with dogs for literally almost a century, that if you take one of the major coronary arteries, you know, one of the things I criticize in my book is the idea that the only cause of heart attacks is blocked arteries. Mm-hmm. And, you know, this theory, which again is a theory that somebody came up with, which, by the way, most of the cardiologists in the 40s, when they came up with this theory, were adamantly and vociferously against this theory. In fact, they said that the people with the blocked arteries had fewer heart attacks because they had a more robust collateral circulation, which is the small blood vessels that essentially bypass these blockages. Mm-hmm. So it wasn't until they essentially got on board because of interventional cardiology and stents and bypasses, and, you know, essentially they realized they could make tons of money by unblocking people's arteries, that they got on board with it. The early studies showed that somewhere between 20 and 40% of heart attacks are even associated with some blockage of an artery, that 60 to 80% show no significant blockage to any artery leading to that area. Now, what you're talking about is what they found is if you take a dog with, say, normal coronary arteries, and you go essentially from 1 second to the next, if you ligate that artery, so essentially if you tie it off, so it's flowing normally, you tie it off, you will cause a heart attack downstream from that ligated artery. Mm-hmm. But if you do it slowly, So if you do a little bit every day for a month, the heart will compensate by forming this collateral circulation, and there will be no heart attack. And the relevance of that is, 90% of the stents and bypasses are done not on people who had a blockage from one day to the next. That's extremely rare. But these blockages have built up over years, even decades. So it's more like the second case, which is why, according to the Mayo Clinic, study in 2003 and other studies, there is no improvement in recurrence of heart attacks, having heart attacks, or length of survival by doing stents or bypasses. The only thing stents or bypasses do is they relieve symptoms. And it's a bit like, the reason for that may be even because you cut the nerves in your heart so you don't feel the pain. It's a bit like if your check engine light comes on and you bash the dashboard with a hammer, then you don't have a check engine light on anymore. So you fix your car.
There's a guy I know who's about 80, he's got to be about 85, and he has some heart issues, a lot of heart issues. And he, over the last probably 20 years at least, he has had, I think he has now about 7 or 8 stents around his heart. And I'm curious, what do you think that's, it's hard to say, but what's going on there, do you think?
Obviously he has pretty aggressive atherosclerosis, meaning plaque formation in his major blood vessels. And so he goes in and has them cleaned out. The question then is whether that actually is the reason why he's been able to live so long. And again, it's hard to say in an individual case, but you're not allowed as a cardiologist to say this stent or bypass will help you live longer or not have a heart attack.
Oh, you're not allowed to say that.
You're not allowed to say. They do it anyways. But studies have shown that that's not the case.
Interesting.
The reason for doing a stent or a bypass is chest pain, period. That's the only thing it's been definitively shown to help. Now, there are some occasional exceptions. There's a so-called proximal LAD lesion, which means that there's a complete blockage at the part of the coronary arteries before it's branched into its separate arteries.
Okay.
And that's a bad place to have a 90+% blockage.
Okay.
So that one, in an acute situation, maybe saves lives and prevents further heart attacks.
Interesting.
The rest of them, it's not been shown, and it's been done over and over again because they would love to show that this is the case.
Yeah, because they're looking for that sort of information to keep selling the whole thing, right?
Exactly.
Yeah.
It's a billion, maybe $1 trillion enterprise. We have entire, areas of hospitals and cardiac centers devoted to basically, cleaning out people's arteries. And it would be nice to show that it's doing some good besides just alleviating pain.
Right.
It's just hard to come by because that's not the problem. That's the reason.
Yeah, that's so crazy. I don't know if you heard over the music. I know that on the phone line for the guest, the music kind of gets kind of wonky at the beginning of the show. But I was reading some stats that I found, and it was saying, and I'm sure you can corroborate this, but 1 million heart attacks will occur this year, resulting in 500,000 deaths. And then the other stat was coronary artery disease is currently the leading cause of death in the United States. And it's just interesting that if both of those are true, that we spend so little time growing up or, in our adult life taking care of our heart, if it's the leading cause or the second or third or fourth leading cause of people, we should be taking care of our hearts, shouldn't we?
Well, yes. And it's also interesting, they say that the leading cause of death is coronary artery disease. So they're already putting you in a box. the proper way to say it should be the first leading cause, the number one leading cause of death in the United States and other westernized countries is heart attacks and death from, heart disease, not from coronary artery disease.
Ah, okay.
And so they're already boxing you in, making you think that the only reason for heart disease is coronary artery disease. Once you buy that, then you buy into statins and stents and bypass.
Mm-hmm.
So you're already kind of hooked by just even that wording.
Yeah, it's interesting what has been done with the use of labels and language and things in today's culture, especially in the medical industry. It's really fascinating because you have this language that's being used, and people associate drugs with language, and they map all the labels of certain diseases to specific drugs. I mean, it's just genius how it's all set up. It just blows my mind.
No kidding.
Yeah.
And even the billion-dollar statin industry for, so people think, okay, heart attacks are caused by blocked arteries. Blocked arteries are caused by cholesterol depositing in your arteries. So if you reduce cholesterol, you'll get less blocked arteries and less plaque and less heart attacks and less death. If you dissect that, the whole thing, first of all, coronary artery disease is not the major cause of heart attacks. Second of all, nobody thinks that the plaques consist of cholesterol.
Mm-hmm.
That's completely a myth. The plaques are inflammatory debris, which the cholesterol essentially seals the wound, and there is no deposition of cholesterol forming the bulk of these plaques. And third of all, there was it's been well known that giving people statin drugs and lowering their cholesterol has basically no effect on plaque development.
Wait, say that again?
So, giving people statin drugs and lowering their cholesterol has no demonstrable effect on plaque development.
Oh.
And, of course, they would love to find out that it is. So the theory is we just don't lower the cholesterol enough.
Ah.
Now, mind you, if you do a analysis of death rates depending on cholesterol, by far the highest death rate are the people with the lowest cholesterol. That's for sure.
That's
been known for 50, 70 years.
Now, what are they trying to get the cholesterol lowered to? It keeps getting lower all the time. What is it now? Do you know?
Well, less than 100 LDL.
Are you serious?
I'm serious. But even that is considered not low enough. So they just came out with a very interesting study, which is an injectable statin drug.
Oh, no.
And this is like the holy grail because it gets the LDL under 60.
Okay.
So they did an 18-month trial. That's the sort of definition of a long-term trial
right.
of keeping the patient's LDL under 60, which is basically zero.
Okay.
And that's the highest death rate. And what did they get with the plaque? They were, quote, encouraged because they found a 1.5% reduction in the plaque in their coronary arteries. Now, let's dissect that one a little bit.
Yeah, please.
The way you assess percentage of plaque in a coronary artery is you do an angiogram, so you put dye in there, and you say, okay, you use a caliper, and you say, okay, this blood vessel is, say, 4 millimeters, and the plaque is 3.6 millimeters, so you have whatever 80% blockage.
Right.
Right? That's how they assess it. Now, if you give that to 3 different people, the one guy will say the artery is 4, and the next guy 4.2, and the next guy 4.1, and this guy will say the plaque is 3.8, and this guy will say 3.6. So there's some scatter in the measurement by definition. So if you get a 1.5% reduction, you've got nothing, or as they say, bupkas, because That's nothing. But they were encouraged because it was the first time they showed that with really aggressive lowering, never mind that it sets people up for cancer, neurological problems, weakness, muscle aches, infections, you name it, by getting your LDL that low. Never mind that, we got a 1.5% reduction in the plaque. Hallelujah.
Oh, my gosh. Yeah, last I heard it was, I think, 120 LDL, but now you're saying it's under 100.
Well, and if you've had a heart attack, it should be under 80.
Oh, my gosh. You know, I was reading something a while back that was saying that, you know, it becomes increasingly more and more difficult for the body to create hormones and balance hormones after you get below like 180 or something like that.
Right. All the hormones, estrogen, progesterone, vitamin D, cortisone, these are all steroids, meaning they all are derivatives of cholesterol. And it's like I say to people, if you want to make tires, you better have rubber. Although I guess they don't make tires out of rubber anymore. Let's just say they do.
Yeah.
And if you want to have testosterone, you better have some cholesterol.
Yeah.
And if this guy is aggressively lowering your cholesterol, expect that you're going to be hormone deficient. That is not a side effect. That is a consequence of that strategy to life.
Now, the question that I have, and it seems like most people would have this if they're going to a conventional cardiologist who hasn't been exposed to differing opinions and differing information, is if you were getting your cholesterol checked and the doctor's constantly and aggressively lowering it like you're talking about, and you're also monitoring your hormone levels from different angles and different blood tests during the same time, and you can show that doctor that my hormones are, you know, dropping significantly as a result of being on these drugs, doesn't the doctor know the drugs do that?
Well, I don't necessarily want to speak for other doctors, but they know it a little bit, but they just would say, what, so you want to die of a heart attack?
That's it? Wow.
So you can't get up in the morning. Too bad. At least, well, I wouldn't say you're up, but you're...
Yeah. At least you're alive and you're not dead from a heart attack. And, you know, if the hormones have to go a little bit, then that's just what we have to do, right?
What we have to do.
Wow. That's unbelievable. So... is that true that the hormones, is it around 180 that the body's becomes unable to create substantial hormones?
I mean, I don't know that I would say that's exactly the number. I think it depends on, you know, stress levels. People's cholesterol, you know, the main thing that it tends to go up is with people under a lot of stress because, you know, cortisone and these hormones are basically your body's attempt to alleviate stress. They're stress responses.
Right.
So if you have a lot of physical, emotional, psychological, whatever kind of stress, which is sort of the definition of living in America these days, then you need more cholesterol, period. Like you want to get more tires, you need more rubber. I don't know that I'd put a number on it below this. But I also see people who are doing what I think is more the sort of right way of living, which is, you know, good, high-fat, low-carb, natural foods, local, organic, biodynamic, wild food diet, who get regular physical activity. I don't necessarily mean exercise, although it could be, but, you know, who are avid gardeners and walk and, you know, they live physical lives. They tend to have a very similar lipid profile, which is, you know, a cholesterol around 230 to 250, low triglycerides, high HDL, and LDL around 160 to 180. That seems to be what I would say is the optimal pattern.
Yeah, I remember Doctor, before he died, what was his name? Not Doctor, I forget what his name was, but a big time doctor, and he recently passed away, and he was saying the optimal level for cholesterol, total cholesterol that he found in his clinics was around 222, and you're saying 250, and that's right in line with that, you know?
Yeah, 230 to 250. That I see that over and over again. If a guy comes in and he's eating a Weston Price, you know, good quality food diet and living an active life and pretty happy with life, his cholesterol is always in the 220 to 250 range.
Mm-hmm. Mm-hmm. Pretty cool stuff, huh? So we are with Dr. Thomas Cowan. Cool guy. Cool guy. His website is Human Heart, Cosmic Heart, and this is episode 549. So if you want to grab the show notes, you can just head on over to extremehealthradio.com/549, and you can grab all the show notes for this particular episode. I'm just loving this stuff. Really quickly, I wanted to let you guys know, I'm not sure if you guys had heard about this Rapid Release Technology Pro 2 product that we have in our store. I would highly recommend checking this thing out. I used it a while back, a couple years ago. Actually, let's see, what is it? June of 2016. And this is a high vibrational sort of treatment that a lot of doctors and chiropractors now are using all over the country. And I just saw one of the UFC fighters using this thing after one of their bouts. And so what this thing does is it helps to break up knots and scar tissue and trigger points in the body. And what happened with me is I had a debilitating back pain. I initially injured my back in the gym doing bent over back rows, I think it was. And my disc has never been the same. But what happened was I re-injured my back last June of 2016. And it was to the point where I could barely even walk. it would take me probably about an hour and a half to get from one bedroom to the next bedroom in our house. And after a week, it was worse than when I initially injured it. It was the worst pain I had ever felt. I couldn't even lay down. I couldn't stand up. I couldn't sit. It was just excruciating pain all the time. And it wasn't until a local practitioner came by and used this machine on my back where everything changed. And what's cool about this is it uses high vibrational therapy and vibrational frequency on your back. And so it's great to have around the house. If you ever, injure yourself or anything, it's just a nice tool to have on hand. I use it over my face. I use it over my neck. I use it over my lymph nodes, like before I rebound or before I get in the sauna. I'll use this to stimulate my lymphatic fluid, or my lymph nodes in my armpits and groin area in my neck. It's an amazing piece of equipment. I can't recommend this thing highly enough. I really check it out. Go to our store if you want to check this thing out, and you can watch. There's some videos with former NFL great Terry Bradshaw. He's on there, and you can watch and check out some of the testimonials. I can't recommend this thing enough. So make sure to check out the Rapid Release Technology Pro 2. And before we get back to our dogs have been just loving this raw dog food from Barf World. They love it. We initially put Maggie on it, and that was our dachshund, and she absolutely loved this stuff. And now both of our dogs, Coco and Charlee, just thrive on this dog food. And it's raw, which is super, super critical, but it also has the entrails and has the bone, so it has a perfect acid-alkaline balance. They have different flavors like beef and chicken. And so we've done a bunch of interviews with Robert Mueller, who's the founder of that company. And I'll put a link to their store page on this particular show page, which is extremehealthradio.com/549. But your dog will have, our dog had more energy, Maggie did, and Charlee, better skin, better coat, better shine. They slept better. Their bowel movements were, they weren't all gross and disgusting. They were just fluffy and just super, super changed and transformed their health. So if you love your dogs, if you have a dog, check out the Barf World. I think you're really, really going to like it. So yeah, if you want to check out the Barf World raw dog food or the Rapid Release Technology Pro, I'll put a link to both of these if you're interested at extremehealthradio.com/549. And that will just link over to our store, and you can watch some videos and check out some more information about both of those products. But I want to get back to Dr. Cowan here. Super, super interesting information. And I got a question here about atrial fibrillation. So I have a question that I want to ask for myself and also a listener question first. Let me take the listener question. It's kind of long, but he's about 45 years old, has his own business. There's some stress in his life, obviously, with having your own business. And he has been diagnosed with atrial fibrillation. And he's wondering what he can do about that as a result of this diagnosis. He's starting to take care of his heart now and eating better foods. He's taking supplements, he says, like cayenne and nattokinase and things like that. In terms of the electrical aspects of the heart, like atrial fibrillation, what can be done there?
So, first of all, atrial fibrillation, it's always tricky to tell somebody what to do out of context because, for instance, eating low-fat diet and taking statin drug predisposes people to atrial fib. So if that's not the case, then the interesting thing about this is atrial fib is not actually an electrical problem. It becomes an electrical problem, but it's a metabolic problem of the heart that shows up with electrical dysfunction.
Okay.
What I mean by that is if the normal electrical system of the heart, the pacemaker node is called the SA node. That's in the high part of the left atrium, and it sends out a signal that goes through essentially like a wire to the ventricle, and then the ventricle contracts, and then it repolarizes.
Mm-hmm.
With atrial fibrillation, for instance, SVT, which is a pure electrical problem, there's a redundant or accessory pathway from the SA node to the ventricle. So that's a pure electrical problem.
Okay.
The analogy I like to give, it's like you have a gate that has a electrical opener and closer of the gate.
Mm-hmm.
And SVT and some other rhythms like Wolff-Parkinson-White, those are the electrical the electrical system that opens and closes the gate is faulty. With atrial fib, somebody ran into the gate and the gate doesn't close properly. And what happens then is the transmission of the signal doesn't happen, and so the heart starts going its own way and sending out aberrant signals, and then there's no conduction rhythm properly.
Mm-hmm. And then at that point, the person's heart starts beating erratically, and they get scared.
Yeah,
and things,
irregularly irregular.
Yeah.
And the problem with that is then you can get, if there's not proper blood flow, and interestingly, I talk about in my book, the flow inside the heart is in the shape of a vortex.
Okay.
And what happens with atrial fibrillation is you start losing the vortex, the spiral formation of the blood.
Okay.
And Leonardo da Vinci was the first to identify this spiral formation of the blood within the heart.
Mm-hmm.
He used grass seeds suspended in water and a basically blue glass to the shape of the heart, and showed that the movement of the blood inside the heart is in the pattern of a vortex.
Mm-hmm.
When you have atrial fibrillation, you lose the vortex, and that tends to make the blood have a more tendency to clot, and then you can make clots, which then go to your brain, and you can get a stroke. So that's the problem with atrial fibrillation. But it's clearly a metabolic problem of the heart. That's why ablations tend not to work, and you can slow the rhythm down with drugs like beta blockers,
mm-hmm.
but you can't get the rhythm to go back into normal. So in order to do that, which I would say is very difficult, and this is one of, it's interesting that's the first question, because you have no idea how I wish I had the solution to atrial fibrillation. Because, first of all, I'd have a lot more money than I do now.
Right.
And I get 2 or 3 patients a week, I think, whose main complaint, either they call me or email me or come in person,
mm-hmm.
with atrial fibrillation. And you have to rehabilitate the ability of their heart to function metabolically. And that means, all the things I wrote about in the book, which means good fat, low carb, intermittent fasting, good quality food diet. You need to get in good shape. You need to walk barefoot on the beach. You need to take Strophanthus, which is the heart medicine that helps the metabolic function of your heart.
Mm-hmm.
there's a Chinese medicine called Dan Shen, and then you need to take something to thin the blood so you don't have as much tendency to clot, and that could be anywhere from Coumadin, which is a sort of toxic blood-thinning drug, or combination of vitamin E and nattokinase and ginkgo biloba. Those sort of things also will tend to thin the blood.
Mm-hmm. Mm-hmm.
So it's a tough nut, because what it means is your ability of your heart to function metabolically, meaning extract oxygen in food and get rid of waste products, is compromised, and so that creates the electrical instability.
Mm-hmm. Now, I'm wondering, in terms of like electricity, it seems to me that there's got to be some connection, like you said, connecting to the earth and walking barefoot to bring those negative ions into your body, into the bottoms of your feet, where we have so many receptors for them, would be a good electrical sort of recalibration. But I'm also wondering, do you think there's any connection at all to all of these Wi-Fi signals and cell phones and things to the AFib?
So the answer to that is, without a doubt, absolutely.
Interesting.
And I can also tell you that AFib is literally a epidemic in this country. It, compared to when I started practice 30 years ago, hardly ever saw anybody or heard of anybody with AFib. I mean, it was around, but now, literally, I get calls and emails and new patients every single week with AFib.
Wow.
And so, yes, it's an electrical instability, the opposite of what you said about walking barefoot on the sand or the grass, is exposing yourself to these electromagnetic fields. And I'm no expert on that. I'm friends with a woman who wrote a book called Electronic Silent Spring, and so I know enough to be dangerous, meaning that's dangerous.
Right. Now, I'm curious, too, in terms of AFib and things and the electrical side of things, have you heard of or have had any experience using devices like Rife machines or PEMF, which is pulsed electromagnetic fields? Does that affect the heart and the electrical parts of the heart, do you think?
So I certainly know about Rife machines, and I also know a fair amount about pulsed EMF therapy. And I use a light machine, which is a biophoton machine in my office, which has Rife settings on it. At this point, I can tell you it doesn't resolve people's AFib or other electrical problems. I wish I could say differently. I have a feeling that we don't know enough about what frequencies to use or the how often to use it, so that it's not as optimally effective as supposedly it was for Royal Rife.
Right.
That's my impression, and I'm not an expert on it, so I can't say that it doesn't work, but my experience has been for treating electrical problems, it hasn't worked. But it's also been difficult because I have this machine and people have to come in 3 times a week for 20 minutes, and maybe you need to do it every day for 2 hours, and that's, it's a $20,000 apparatus, so people can't buy it, so how do you do it? It becomes a kind of logistic nightmare, and so I don't know how to get around that to even know whether it's going to work or not.
Yeah,
I have a feeling that it's part of the equation, that we're because we're locked into this mechanical pharmaceutical model of life, really, we can't even develop reasonable therapies that would actually help people and not poison them.
Yeah, wasn't it Tesla who said that man is much more electrical than they are mechanical or something?
Well, my whole theory of why the blood circulates, it's basically an electrical model. There's electrostatic charges in the blood, which create repulsion, which creates the movement of the blood.
Mm-hmm.
It's clear as a bell. So essentially what I did was try to take that statement and actually get into the details of, at least with the blood and the heart, and I'm going to do it with other areas too, like the nerves at some point. But with the blood and the heart, you can see that the movement of the blood comes because of electrical activity, and then the heart creates an electrical field as a torus around the body, which basically entrains the other organs on how they should function rhythmically, to create a coherent organism. So you're right, he was right, but he didn't know the details.
Yeah, it's so fascinating. We got a question here from Andrew, and he says, does Dr. Cowan have any opinion on Bulletproof coffee as it relates to the heart and the cardiovascular system?
Well, I guess it depends. Bulletproof coffee in the context of intermittent fasting, I like.
Okay.
Because I like intermittent fasting, and I can appreciate that the caffeine part actually stimulates the metabolism and maybe encourages all the things that you're trying to do, detoxification and weight loss and reducing inflammation with fasting. And the fact that they put fat in it, whether it's ghee or butter or MCT oil or brain octane or any of those things, all that is very positive.
So I guess the bigger question here is what Andrew's asking is not necessarily Bulletproof, because that's kind of a brand, but he's asking more about the fats and things like this that have been demonized in our culture. And as you know, there was recent articles going around about the, quote, dangers of coconut oil, which is another aspect of the Bulletproof idea with coffee. So what we're talking about here is that the coconut oil and the MCT oil and the ghee and the butter, all of these things have been demonized, but they shouldn't have been, right? They're incredible for the body.
Right. And the answer to that, I talk about compasses. So some people's compasses are double-blind studies or university trials, and I'm not saying we shouldn't pay any attention to them, but they're often, gamed and slanted in very certain ways. So that's not my ultimate compass. My compass is who ate that way and how did they do. And I can tell you there's Polynesians and other, more indigenous people, traditional people, who got 40-60% of their caloric intake was from things like coconut oil, and they never had heart attacks. So if you tell me, it's like people say, humans shouldn't have dairy products, but some of the healthiest people that have ever been studied, that was one of their main foods, if not their main food. Those things just don't square. Even eating meat, I sometimes I have a picture of a guy named Buffalo Bull back fat on my phone. So if somebody says humans are meant to be vegans, I always pull up the picture of Buffalo Bull back fat, whose tribe was very well studied, no heart disease, no cancer, no degenerative disease. He was in his 70s when this portrait was painted. He and his people were a lot healthier than anybody around today. And so I just say, okay, you try to convince Buffalo Bull that they should stop eating those damn buffalo and eat broccoli instead.
Yeah,
and I don't think you could do it because I don't think you'd buy it.
Yeah, in order to find out the answers to those questions, I mean, people love to have solid, concrete answers, because let's say you could say, for example, that, a raw vegan diet is the best diet. Or let's say you could say that a paleo diet, whatever diet you want to pick, you can say that that's the best and most optimal diet for man. But what you could say too is there's so much variance with people, and not just people, but their lives as well. So for a while, I may do best on a vegan diet for, a few months and then switch to a paleo diet and thrive on that. So it's so just challenging to know. There's not one solid answer, I don't believe, for anybody.
Well, there are principles. There's principles, for instance, that if you genetically modify your food, that's not going to work out so well for you.
Right.
If you soak it in Roundup, that's not going to work out so well for you. If you grow it in soil that's nutrient deficient, that's not going to work out so well.
Right.
It's all about complexity and the actual quality of the food, which actually gets us back to the very first thing we talked about. When I talk about diets, in every book and everything I write, I give my principles for diet. And the first principle is it's all about quality. Now, the interesting thing about that is quality is not scientific, because there is no measurable quality. Quality means things like taste and aroma, and it does include nutrient content to a certain extent. Those things are related to quality. But it's an ineffable thing in life which we don't believe in. And so therefore you make mistakes.
Mm-hmm. Yeah, it's interesting. I heard you just mentioned Roundup and stuff, and I heard you once talk about glyphosate and vaccines, and you were saying that the vaccines are grown on gelatin, and that comes from GMO-fed cows, and that's how the vaccines are picking up the glyphosates and the GMOs.
Correct. That research is by a woman named Stephanie Seneff at MIT, who's documented the presence of Roundup glyphosate in vaccines and gelatin and capsules that have gelatin, etc., all that stuff.
Now, how does glyphosate talk about how it apparently produces something called zonulin, which breaks it down or makes microscopic pores in the gut, and it really screws us up, doesn't it?
Yeah, I mean, it interferes with the good bacteria in our gut, which is interesting. The makers of Roundup say that it only affects this so-called shikimite pathway, which humans don't have, therefore it has no effect on humans.
Huh.
And that's cleverly true.
Okay.
But because what it does have an effect on is microbes. And so if it wasn't for the fact that we have 7 to 10 pounds of microbes in our gut, and that they are our immune system, and that they make many of the nutrients, including folic acid or folates, in our gut, then they may not have an effect on us. Mm-hmm. But the fact of the matter is they do, and they seriously impair the growth of lactobacillus and bifidus. What you're talking about is they stimulate the production of a chemical called zonulin, which opens the pores of the gut and allows the contents of the gut to enter into the bloodstream, which is the basis for autoimmune disease. Now, so you say then, okay, what has happened with autoimmune disease in the last 50 years? All you have to do is ask your parents or grandparents. Mm-hmm. They never had anybody with peanut allergies, eczema, asthma was rare, right. Crohn's disease was rare, MS was uncommon, and now they're epidemic proportions. Mm-hmm. So what happened? Well, we have a lot of foreign proteins entering our bloodstream, which we create reactivity against by making antibodies, and they destroy our tissue, and glyphosate is an integral part of that mess.
Jeez. I mean, my wife, she has peanut allergies. She's had that. And we were reading some material a few years ago talking about the the connection between peanut allergies and childhood vaccinations, which I thought was interesting. And then, I have a good friend of ours has got RA, and, it's fascinating because you have all of these new sort of new diseases, but I mean, they're popping up everywhere. And, I was reading something recently where they were saying that the amount of different strains, not the actual total amount of bacteria in the gut, but the amount of different strains and species is supposed to be around like 1,000. And now we're down in America, he said, to, I think, somewhere around 300. So we've lost like 70% of the species. And what he was saying was, which I thought was fascinating, was, the bacteria that would typically allow someone to turn the nutrients of like a banana into, nutrients you could use from like a steak, some other type of food, that bacteria is not there anymore. And as a result of that bacteria not being there, our ability to consume different types of food, it seems to be going down without people getting some sort of reaction to them. And I thought that was a really fascinating way of putting that. And I wonder if that's true.
I totally buy that.
Mm-hmm.
And not only, and another thing is, there was a very interesting study from this medical anthropologist who's part of the Human Microbiome Project, where, he measured his own microbiome, the diversity. The diversity is everything. And he got a certain level of diversity. And then he went and lived with one of the few extant hunter-gatherer troops in Africa for just 3 days. 3 days, nothing. One of the things he found out was they eat between 300 and 400 different species of plants and animals per year. So, whereas Americans usually eat about 20, and that includes potatoes and French fries and tomatoes in ketchup and chicken and iceberg lettuce and a few other things.
So now the question becomes, what are we doing to ourselves as a result of that? Do we even know the answer to that question?
Well, what he found out is after 3 days, the diversity level increased by 20%. 3 days.
What do you mean? The ability for someone to be able to tolerate new foods?
No. The types of different species living in his gut. Just from eating the diversity in that African tribe for 3 days. In other words, Americans and I guess Westerners, but I know Americans better, they live in a food desert. Even people in the Bay Area where I live, the food capital of the world practically, it's better here, but there are no wild vegetables. There are no perennial vegetables. People eat, maybe they go from 30 to maybe 60 species of plants and animals per year. But the normal human diet is 300.
That is
and each of those different foods, oysters, peanuts, cabbage, perennial greens, ashitaba, wild, mallows, all those feed a different kind of bacteria in your gut. And so if you get rid of 90% of the species, you will get rid of 90% of the species growing in your gut, and then you have a monoculture. And anybody who knows anything about farming or gardening knows if you monoculture, you're going to get a sick field, garden, or plant.
And essentially, when you're doing that, you're raping the soil, and if you're doing it in gardening, you're doing the same thing in your gut then, right?
Exactly.
So
you're raping your gut. That's your immune system. That's the part that digests the food. That's the part that keeps things from getting absorbed into your bloodstream. I mean, this is a health nightmare. We are living through a literal health nightmare.
I believe it. I mean, we see it what person doesn't have someone in their immediate friends or family in their inner circle that doesn't have some kind of disease, But I wanted to ask you about, in terms of this, you've talked about leeks in the past. Like leeks help to promote a really high diversity of bacteria in the gut. Is that correct? That
is correct. According to the Human Microbiome Project and this very interesting woman gastroenterologist who I can't remember her name, but she treats Crohn's and colitis with diet, and she said that the thing that determines the success or failure of her approach is the amount and type of vegetables that people will eat.
Really?
Now, there's other things in the diet as well, like good fats and fermented stuff. And the number one food for improving the microbiome is leeks. That's why, we in my family, we started this company called Dr. Cowan's Garden, where we take vegetables, some that we grow, some we source from local farmers or organic places. It's all organic. Some we're even hoping to move to biodynamics. And we essentially dry them and put them in Mirin jars so that people have easy access to a wide diversity of vegetables. And the whole thing, in a sense, started with leeks for two reasons. One is dried leeks, powdered leeks, taste amazing, so you can put it on every food you eat. And two, because they are the food that supports the greatest diversity of human microbiome.
Now, what does that mean? They actually create different species, or they help certain species grow? What do you mean by that?
Well, they don't create the species, but what grows is what you feed. So, all these species, in theory anyways, at least used to live in your gut, and the balance will be because of what you feed them. So if you feed them only sugar, you'll get eventual only, candida yeast growing there. If that's the only food you eat. If you feed yourself only meat, you'll get a different type of bacteria. If you eat a wide diversity, you'll have a diverse, flourishing ecosystem like a healthy field or biodynamic, garden.
So it's really important to grow, if you can, wild food, right? And kind of don't they call that like chaos gardening or something, where you kind of just let nature take its course, and as a result of that, the plants are able to produce certain minerals and alkaloids that help to, build its own immune system, and that's what we get, right?
Yeah, I would say there's an interaction between humans and the environment. It's not just like, okay, nature, do your job. There's a certain amount of that, but my model for that was written in a book called Tending the Wild, which was a description of California before the white men came. And basically the entire place was a cultivated garden. Now, it didn't look like what we call a cultivated garden, but, they burned and pruned and transplanted so that they had everything growing at different places where it grew best. And, they were stewards of this process. There is at least potential role for human beings in nature, at least potential. And you can recreate that to a certain extent with permaculture, and, we do that a little bit with our garden. We grow perennial vegetables, and we try to grow as many diverse things as we can. At one point, we had 59 different edible species growing at one time. So it's all about creating diversity and strength through diversity.
What is the difference between biodynamic and permaculture?
Biodynamic comes from Rudolf Steiner and anthroposophy, and it was a way of treating the soil with different preparations to encourage the life of the soil.
Okay.
So it was a specific way of doing gardening or agriculture, actually from a course given by Rudolf Steiner. Permaculture, in a sense, is new, or newer. In a sense, it's as old as the hills, but it's a way of looking at how nature organizes itself, using layers and temporal organization to create self-sustaining essentially food ecosystems, or sometimes they call it food forests. So you have the trees growing on top of the bushes, on top of the mushrooms, next to some fields where you have annuals mixed in with perennials. And my take on it is both are great. I'm not going to get into a fight about whether to eat permaculture food or biodynamic food.
Right.
I have a little bit of a hugel permaculture thing growing, and we're working on a little bit of a biodynamic thing, although we don't have the preps right.
Mm-hmm.
So I'll do it all.
Mm-hmm.
What I won't do is, monoculture chemical agriculture.
Yeah, I hear that.
If somebody has an idea that this is the best way to grow a carrot next to a beet, next to a turnip, next to a tree collard, next to a goji berry, next to a fig tree, and they all work together, I'm good. It's great. Everybody should try to figure that out as best they can.
Well, what's nuts is I was just reading an article recently about how people they're talking about creating like this sort of manufactured meat. So there's a new meat that's going to be available in the future, and they're working on it now. It's not actual meat; it's something else. And it's like one of these things that goes back to what we're talking about before. Like, we're not just these mechanical machines that we can just eat something fake like that. We're our connection to nature and to the food we eat and to our whole life in general is dependent on this connection. And eating fake food and fake meat, I mean, I just don't get it.
Right. I mean, that's where you get into, if people have no sense of quality, they think that's fine because it has X amount of protein in it.
Right.
And, all I can say is that's not my way, and
yeah, it's just nuts. I mean,
I can't understand how somebody can be so gullible to fall for that.
Yeah.
But I guess they are. I
know, it's absolutely crazy, and they're doing the same thing with vegetation and vegetables and fruits with GMO. I mean, this stuff isn't food. I was reading a book recently called, it's the Anastasia Series by Vladimir Megre, and it kind of coincided with a guest that we had on a while back, and she was talking about how important it is to connect to nature. So what she was saying was like really actionable things that you can do, like, touch the plants, touch the grass, smell the flowers, put your hand in the dirt, and breathe the fresh air and get in sunshine with no glasses on. And she was talking about how important it is to have that physical connection, even if you just put your hand in the backyard, put your hand in the dirt, and live more in connection with that. And that's kind of like what this book is talking about, the Anastasia series, but it's so non-mechanical. It's so in touch with the cycles of life. It's so anti this sort of mechanical view that we have with medicine these days,
Right. I mean, I would put it maybe more simply. I've actually read those series. It's very interesting. But if you or somebody listening wants to do something good for yourself, grow some food. As simple as that. It's the most human activity you can do, and it will encompass all those things. You'll be outside, physically active. You have to care for another living being. You have to understand what it wants and what it doesn't want. And if you try to grow a watermelon in winter, you'll find out what the watermelon thinks of that. You have to then live with how nature is in fact. And you'll spend your time, and this is a big thing with me, you'll spend your time doing things because they need to be done at a certain time, not because you decided to choose to do something at a certain time. Mm-hmm. And what I mean by that is if, like me, I start seedlings. So when the seedlings are a certain size, you have to put them in the ground. It doesn't matter what you think about that. That's the time to put them in the ground. And then you have to harvest them at a certain time where they go to seed, or you have to process them at a certain time. So your life becomes doing things based on when they actually need to be done. which is different than going to work and deciding, okay, I'm going to, whatever, I'm going to crunch numbers and do a financial plan because why? Because I got nothing else to do and that's my job.
Right. Yeah, it's so different
sense of reality.
Yeah. Do you follow a lot of the principles? She talks about walking barefoot on the soil and then like putting saliva on the seedling and all kinds of stuff like that. Do you do that kind of stuff in your garden?
We try to walk barefoot on the beach as much as possible. I don't walk barefoot in the garden because it would take me a whole lot longer to do the work that I need or the stuff that I need to do until I got my feet primed for that, and I just haven't done that.
Yeah, it's an interesting idea. She talks about how the feet exude toxins, and a lot of different alternative medical or natural doctors will say that toxins will leave your feet, and then the soil reads what those toxins are, and then deposits those toxin chemicals into the seed, and then the seed creates a fruit or vegetable that will counteract those things that you actually need. And I don't know, I just thought that was an interesting idea.
Yeah, well, I remember reading that, and thing is, I have a pretty big garden, so to lick all my seeds would take
it would take forever, wouldn't it?
It'd take a while, but
yeah.
I remember that. So if you lick the seeds, the plant reads something about your DNA, and then it makes something that will help you out. Frankly, I can't verify that because I've never done it. I don't know whether that's true or not. But I'm not sure it isn't true either.
Yeah, at the very least, if it creates a placebo effect in your own nature, then that's kind of cool too,
Well, at the very least, if you lick the seeds, you might get a little more moisture in the seed before it has while it needs it. So that may be a good thing too.
Yeah, and maybe there's bacteria that's good for us on the seed too.
Yeah.
Going back to your book and sort of wrapping up here, I wanted to ask you, chapter 10 talks about the cosmic heart, and chapter 11 talks about the heart of gold, and I'm curious what you're talking about there in those chapters.
The cosmic heart just points out that some of the rhythms, like the Platonic year, is exactly the same number as the amount of breaths per day.
Mm-hmm.
So we are not just isolated, as we're talking about mechanical earthbound beings. We are that as well, or earthly, but we have a connection with the wider cosmos. And you can see that in actually crunching the numbers and looking at the rhythms of the heart. Now, as far as the heart of gold, that's something that has been talked about for, literally millennia. And again, there's no gold in the heart. So if you're stuck with the physical, mechanical description of life, that doesn't make sense.
Mm-hmm.
But I actually presented a theory as to what the heart actually is doing to the gold that makes sense and maybe actually connects the whole history of gold and money and alchemists to our heart in a way that actually begins to make sense of that whole thing.
Huh, that's so interesting because gold is a mineral and
it's a metal.
Yeah, metal. Sorry, and I wonder if there's any connection between like ormus gold. I've heard people talk about ingesting that.
Exactly. That's what I'm proposing. That, and I actually just was sent some other information that shows that you can create this ormus gold by putting it into a vortex, which is exactly what happens within the heart. So I think the heart is a monoatomic gold creator, which is really the mystery of gold and the mystery of how to create a quantumly coherent organism.
Yeah, because it is bizarre, right? Human beings here on Earth, and for some reason, gold was chosen as the the metal of choice to be valued. And I mean, why do we choose gold and not some other metal? You know, so there's some connection.
I wondered about that when I was 4 years old. I said, what's the big deal with gold? You can't even eat it,
right?
You know? And why do we call gold money? And why do we fight wars? And why do these pharaohs and kings and princes wear gold on their crown chakra? You know, what's the big deal?
Right.
Why did the most renowned scientists in history, you know, Galileo and Newton and Robert Doyle, all spent their whole life trying to make gold? I mean, like, what's the big deal?
Mm-hmm.
And anyway, so I tried to come up with an answer for that, which is that chapter in the book.
That's so cool. So just one final question here, closing out the show. Just in general, I know we can't give medical advice, and that's not what we're doing here. And you need to check with your doctor because we're not going to assume any liability for anything. But in general, like there are some supplements and minerals and nutrients that I know about for the heart that people talk about, like magnesium, or people take nattokinase or vitamin K2. What are just a handful of supplements or vitamins or minerals or things like that people could start looking into, doing a little bit of research for their heart?
I mean, you know, first of all, the supplements and medicines I use for the heart are all on our heart website, which is humanheartcosmicheart.com. So there's things like, you know, beet juice and hibiscus, which both help heart and blood pressure and circulation. There's vitamin E, which has been shown to reduce heart disease ever since the Shoot brothers in the 40s.
Wow.
There's an herb called Dan Shen. There was one study with people with angina had 80% remission by just using this herb called Dan Shen.
80% remission in what?
What?
What was the 80% remission in?
From their angina.
Oh, I see. Okay.
So, you know, there's all that stuff. And then there's our, you know, kind of special favorite heart tonic, which is Strophanthus, which I wrote about a lot in the book. And, you know, that's also available. So,
I see. Okay. You know what? On our last show that we did, if people are interested, if they want to hear more about The Heart Is Not a Pump, that was episode 457. If people want to check that out, you had talked about that Strophanthus, and I wasn't able to find it anywhere, and I don't think you had it at that time. But is it a brand new product for you?
Well, I've been using it for a decade, and we have it on our website, but only if you go through a practitioner, because it's a very, you know, it needs some care and needs some information. So we're asking people to find somebody, you know, anything from a cardiologist to an internist to a acupuncturist to a chiropractor, some licensed health practitioner who then can get it from us. We ask them to be on a call for 15 minutes so I can explain the details of it. And there's also information on the news part of our website called The Story of Wabain, and Wabain, the Insulin of the Heart, which goes through the history of it. But yes, we do have it, and we're trying to make this medicine, which is really the heart tonic, to become something that's in general use in the United States.
Wow, this is really, really cool. And so do you work with people, you said you work with people over long distance, like if listeners want to call you up and work with you long distance, do you do that?
They have to have the initial visit unless they live in the state of California. They have to be in person. And, you know, I'm hoping more that rather than everybody call me, that they go through some health practitioner who then I can teach them how to use Strophanthus. Okay. And we can do it that way, because for me to try to be the doctor for everybody who has heart issues is more than I care to take on.
It's not something that's scalable, right? You can't see everybody.
Yeah, and I'm on the way out, not the way in.
That's funny. Wow, Don Shen. Okay, I'm going to look more into that, and as well as the hibiscus. You think that's obviously it's on your website, so it must be really powerful.
Hibiscus, the one that we have is great. It's uber cold pressed and mixed with structured water, the whole bit.
Wow,
that's great stuff.
This is cool. All right. Well, thanks, Doc, for spending some time with us today and talking about your book, Human Heart, Cosmic Heart: A Doctor's Quest to Understand, Treat, and Prevent Cardiovascular Disease. Thanks for your time today.
Okay. Thank you.
All right. Awesome. Hang on the line there, Doc, really quickly while we close out the show. I just want to thank everyone for joining us. This was episode 549. So if you want to get the show notes, I'll put links to all of Dr. Cowan's websites on extremehealthradio.com/549. So that's all you got to remember if you want to grab the show notes or check out any of the sponsors, any of that good stuff. So thank you again for listening. We'll put links to his books there as well, too, if you guys want to grab those, which I'd highly recommend you check out. But thanks for listening. We really appreciate it. If you know anyone that has heart issues or any, cardiovascular issues going on, please pass this show on to them and let them know there are choices. So thank you guys for joining us. We love you, and we'll catch you guys on the next episode. The history of heat therapy dates back over 2,400 years, and it was Hippocrates who said, "Give me the power to produce fever, and I will cure all disease." This FDA-approved medical device called the Biomat is a mat that you can lay on, read on, sleep on, do yoga on, sit on, and it can be used on office chairs, massage tables, and the like to help the body heal itself. It's inlaid with 30 pounds of healing crystals using amethyst and a rare black tourmaline, producing negative ions in a healing electrical field. These healing crystals help to restore cellular health by replacing electrons to the atoms, as well as penetrating deep into the body by 4 to 6 inches. What can the Biomat do for you? It'll improve your skin, burns as many calories as if you went jogging for 30 minutes. It improves the immune system by up to 40% or more, reduces stress and fatigue, removes toxins, lowers cholesterol, relieves pain, revitalizes cellular metabolism. It improves cell channels to deliver nutrients and oxygen to every one of your cells. It activates over 3,000 enzymes. And even a Harvard medical study showed cancer cells die at over 42 degrees Celsius. It reduces stress hormones by up to 78%. It allows your body to produce heat shock proteins, which increases endorphins, NK cells, T cells, and lymphocytes. It's very, very low EMF, and it's got a 17-layer technology. Dr. Mark Serkis is the director of the International Medical Veritas Association. Explain to us more about these biomats.
These biomats are these far infrared mattresses. You lay on them, or you sleep on them, or both. You do very heavy treatments during the day, and at night you sleep at just a nice comfortable temperature. These biomats are like these love machines, comfort machines, and healing machines, because what they do is they just radiate out light, far infrared light, and you can radiate yourself all night long while you're sleeping when you're not doing anything else. And what happens is this light penetrates the body and turns to heat. And the first thing that happens when you bring your core body temperature up 1 degree is your immune system strength increases by 40-50%. They feel when you lay down on them, you guys know, you have one. So it's like the feeling is so good. It's like being in the cuddling with a lover, your wife or husband. It's just warmth and comfort.
How are you using biomats for patients in your clinics?
The cancer treatment using heat is very aggressive, meaning during the day, you sandwich yourself in between two of them, turn it on to high heat, and bake the cancer. The cancer will die before you will. No, this is, you can go to England and spend $20,000 and use microwave a cancer out of existence. These biomats basically do the same thing. Radiation therapy for cancer is really a solid idea. Unfortunately, oncologists use the wrong radiation. They use radiation that kills you. This biomat uses radiation that can save your life and make your life more comfortable, keep you warm in the cold, and help take care of your kids and all, the list doesn't end.
Yeah, because isn't there some sort of temperature at which cancer cells will start dying?
Right, and it's below the temperature that human cells will die.
So you really like this biomat far infrared technology, don't you?
But it's strengthened me. Well, now the kids are addicted to it. You know, they fight on who's going to sleep on it at night. And it not only changed my life, but it changed my medical practice and my books. This is a great machine for anybody who lives in the cold during the winter. Instead of heating a big house, you just heat yourself. Bottom line, it brings good feelings. Just lay on this biomat and it gives the strength back.
I can attest to that indeed. Kate and I love ours, and we think you will too. Learn more about these amazing biomats at extremehealthradio.com/biomat. Or you could check them out in our store as well. Again, that's extremehealthradio.com/biomat. All right, there you go. Episode 549 of Extreme Health Radio. What do you guys think? Really, really cool guy, right? Interesting ideas about the human heart. And you know what? I think that a lot of this kind of stuff is pretty prevalent. It's my contention after doing, I've only done, 550 shows, 549 shows. I've listened to, thousands and thousands of hours of different stuff and read books and gone to seminars and conferences and workshops and, all that since 2003. And you know what? I think we don't have the first clue as to how the body really works. I really don't. I think everyone has their own opinion, and just as a result of Dr. Cowan being on the show and, talking about all the stuff about how, the heart is not a pump. And, if you were to go to anybody off the street and say, what is the heart's job? What does the heart do in the body? Everybody will say it pumps blood. Right? And so now you have someone who's saying something completely different and showing physiologically how that's the case, and demonstrating that in his books and things. And so I'm just convinced that we don't have any idea of what's really going on in the body. And I think what we can do, I think the easiest solution for all of us to overcome disease and overcome any kind of health challenges we have is getting back to nature. Because until we actually figure out what's really going on, what's going to get us there, that bridge between the current health challenges we have, diseases our bodies currently have, and optimum health is the bridge is getting back to nature. So, getting outside, spending more time outside. Do your best, try your hardest, see if you can't figure out ways to spend more time outside. What I've been doing is, in the mornings when I make a smoothie or a coffee drink or a green juice or something, I'll just take it outside. I'll put the chair out in the backyard and put my feet on the grass and just drink it out there while I'm, just contemplating and just being silent and, just reconnecting with nature. I think spending as much time as you can outside is really, really going to be helpful. And I thought it was interesting too that he was talking about atrial fibrillation. And there's obviously something going on because in most of these people that have this, they spent the majority of their life not having it. So something changed. And it probably wasn't like a big change. It was probably a long-term damage that happened as a result of an inflammatory lifestyle of some kind. And so we become so disconnected from the kind of life that we lead that, we don't even know what's harming us or what's injuring us. And so, and sometimes it takes a lot of effort and a lot of study to figure out what is the problem. But in the meantime, you can aid that process and speed up that process by reconnecting with nature. Like I said, spending more time outside, walk the dogs more, stop wearing your sunglasses for, the entire day. Maybe just, go for little bits of the day and not wear your sunglasses, walking barefoot, touching the soil, growing your own food, growing some food. Even if you're just doing, flowers in your garden, smell the flowers and work with them. And I don't know. I think I think part of the solution, I think that is going to be a big part of the solution. And then there's obviously key things that we can do, acute, solutions that we can do to, address certain issues that we have, but, having that default foundational lifestyle of being something that's connected with nature and, living close to the land is going to be, I think, the foundation of our healing. And so I think it's really important to do all those things and just try to really look for ways where you can get outside more. And then once you're outside, reconnect more. So show more of your skin to the sun. Go without your sunglasses. Go barefoot so your feet are touching and connected to the ground. All of these things, help. And so maybe there's ways for you to take your dinner table outside too, and, eat dinner out in the backyard if you can, if you have a backyard or a patio or something, or, there's just, if we actively look for ways where we can do that, I think that would be really, really helpful for our overall healing. And I thought it was really interesting too. What did you think about when he was talking about the glyphosates and, how genetically modified, food, or I should say material is getting into to the vaccines, the gelatin. Vaccines are grown on gelatin, which comes from cows that are fed GMOs and cows that have been sprayed with glyphosates and all of that stuff. So what happens is that the Roundup gets into the vaccines through the gelatin. And so that begs the question too, are gelatin capsules, are they preferable? I don't know. I know that our friend, I have to see if he's still doing this. What is his name? His friend up in Oregon. He does Vitality Herbs and Clay. He's gone to a mushroom-based capsule from Vitality Herbs and Clay. I'll put a link to that too. They've got some really great products on their website. And if you've never ordered from them before, they've got all kinds of powders and mushrooms and all kinds of really high quality stuff. And if you tell them we sent you, then they'll send you some free gifts on your first order. So. But I know Michael King, that's his name. He was talking about using some mushroom-based capsule for his products. But fascinating stuff with all of this vaccines. And someone was saying recently on one of our shows, what did they say? They said it wasn't necessarily he thought the vaccines that was causing the autism. He was saying that the glyphosates that are in the vaccines or the exposure to glyphosates on food through eating GMO food and non-organic pesticide sprayed food, these glyphosates are interacting with the vaccines kids are getting. So he was saying that the smoking gun isn't necessarily the vaccines themselves, although they do contain formaldehyde and mercury and adjuvants and carrying agents and things like that are incredibly damaging to the gut. But he was saying part of it, and what he thinks is the majority of it, is the glyphosates that are in the vaccines, and that's what's causing when you mix and combine the glyphosates with the vaccines, then you get autism. And so, it's fascinating stuff, right? So, we've done quite a few shows on autism. So, if you guys want to check out on our website, there's an area on the top where it says "Find a Show," and you can go on there, and I think we have a section for autism and vaccines and things like that. So if you guys want to go and look at some of our archives on that, you can take a look at those. And so all of our shows are free, 100% of them, all 549 of them. So if you guys want to sign up to our newsletter, I would highly recommend you do that. We just kind of reconfigured our newsletter, and we're doing some really cool things with it. So we're doing the newsletter on Mondays and on Thursday mornings, Monday and Thursday morning. And what's cool is that you're going to get access to all of the shows, all of the most recent shows. So in the newsletter at the bottom, we'll put links to all of our recent shows so you'll never miss one. But then we've also highlighting our older shows too. And then we're also letting you guys know of any upcoming product sales or discounts that are going on. And we're also letting you know of any of the free summits that are going on. So there's some really cool things coming out of each and every one of our newsletters. They're really short. I keep them short because I know you're busy. But I just want to let you guys know to sign up to our newsletter. That way you can stay up to date with all of our shows. And what we're also going to be doing too in our newsletter is letting you know of upcoming shows that are going to be happening, so that if you want to respond to the email and let us know a question that you have for a guest, then we can ask your question. So we did this in our email today, as we let everyone know that, hey, we got Dr. Thomas Cowan coming on the show. And if you have any questions about your heart, please just hit reply. So that way you can be on the show too. And, something else we've done too is on the right-hand side of our website, we've put on a little icon where you can record a question for us too. So we'll either answer that on the show itself if it's for a guest, or we will answer it on one of our Free for All Friday shows, and we'll play your question on the air. So if you have a question that you want all of us to hear and answer, let us know. And there's an icon on the right where you can do that. So pretty cool stuff. We've recently redesigned our homepage, so you can take a look at that. We've got the latest 18 shows on there. So check that out at extremehealthradio.com. And also I want to invite you to check out our upcoming Extreme Health Academy. We're going to be launching this very, very soon to all of you guys on our newsletter list. So we're going to be launching hopefully sometime in November of 2017. So we're partnering up with Dr. John Bergman, and we're going to be offering courses every month about different ailments people have. So like digestion, diabetes, Crohn's disease, these types of things. We're going to be doing full courses on this stuff. Giving you all the practical tips, what foods to avoid, what supplements to take, all the nitty gritty of why it happens and how to take care of yourself. But we're also going to be doing courses on, each of the different organ systems of the body. So like your hormonal system or the brain or your thyroid or your liver. So we'll be doing full in-depth courses on that. So at the end of it, we're going to keep adding to this every single month. We're going to have just basically like an owner's manual of the human body, and we're going to be adding to it as time goes on. So if we learn some new information about, say, the liver, we'll add it to the liver course, so that will always be updated. So whenever we learn stuff, we'll be adding stuff there too. And you'll get access to masterminds where we'll be able to ask questions to Dr. Bergman and get answers to our health questions. And there's going to be a community in there. It is going to be the number one alternative health membership website in the world. I'm really excited about it. And I think it's really going to help you overcome any kind of health challenge you guys might have right now, or just become sort of bulletproof, like they talk on Bulletproof, that brand, Bulletproof. And so it's going to be the number one place. I'm really excited about it, and I really hope you join and check it out. So there's a link to that on the main page of extremehealthradio.com. So stay tuned for that. And if you sign up early and get on that waiting list, we're going to be offering just massive discounts, sort of lifetime discounts. So you want to be on that list and at least be on the list so you get offered that. We're not going to be offering that to our main list. That will come later. So if you want to get access to all the goodies and all the good stuff and discounts and things, make sure to subscribe to the Extreme Health Academy list. And there's a link to that on the front page of our website right now. So make sure to check that out. Anyway, love you guys, and thank you for supporting us over the years. The last 5 years we've been doing this show. Thanks for sharing our shows. You guys rock. Really appreciate it. So thank you for everything and your emails, and it's just an honor to do this. So we appreciate it, and we'll catch you guys on the next episode.
No material on this blog is intended to suggest that you should not seek professional medical care. Always work with qualified medical professionals, even if you educate yourself in the field of live food, nutrition, and alternative medicine. I'm not a doctor, nor am I offering readers medical advice of any kind. None of the information offered here should be interpreted as a diagnosis of any disease, nor